Good morning, all of you. So, thank you very much, Sujit, for kind introduction. Now, before we start, I would like to take this opportunity to thanks Ozone Anesthesia Group for inviting me. It is my great pleasure and privilege to be with you all in front of all the anesthetic over here. So, today's presentation that is about medical legal issues in cases of death due to during anesthesia. What we are talking about, it is routinely what problems that you face or encounter whenever there is a sudden death of a person when the person is on the operation theater in the operation table. Many times we don't know how to tackle these issues, and there are certain grievances by the relatives in issues where usually sudden death, a healthy person when he enters inside the operation theater, when the patient is uh, just 1 minute. When the patient is healthy and when you inform to the relatives that there is a death of a patient during the operation, and it is difficult to digest that news to the relatives. So our focus here during the presentation will be concentrate only especially on the death during the operation. So I will be talking about why death occurs during the anesthesia or during the operation. What are the different factors which are responsible for death during anesthesia and operation? So in such situations, as an anesthetic or as a doctor, what precautions we need to take if there is a sudden death of a person on the OT table? Then I will be talking about the role of consent and documentation. So these two things, they are very much important as a good defense for registered medical practitioner. Even if there is some allegations, even if there is some complaint by the relatives against the registered medical practitioner. So what will save us is only the role of consent and the documentation. So what role they have if the case is filed in the court of law, and the different defenses that are available to protect ourselves from the litigations, that will be discussed. And most important, we'll discuss some case laws which are related with the anesthetic deaths. So before I start my presentation, I will have some few cases which are already decided by the court, that is consumer forum. So first case, that is about Lakshmanan Prakash. He he's a orthopedic surgeon versus state, that is a Tamil Nadu state, that was decided in 2001. So that is a case related was Madras High Court. So here I will narrate you short history and then I will inform you what has happened actually. So this is a case where a young 24-year-old engineering graduate student, he had an road traffic accident and he sustained some injuries given on the bodies and some element of head injury. So that incident happened near about Bangalore or Mangalore. Then the patient was transferred to his native place, that is in the Tamil Nadu. The person was shown to the family physician and the doctor, that is orthopedic surgeon. As they have decided to operate on that fractured right limb, he was shifted to the hospital. Now, before the operation was carried out, the patient was fully conscious, healthy, and well oriented, except certain minor injuries on the body and some form of some element of head injury. Now, when the anesthesia was administered, hello, when the when the anesthesia was administered, usually he was given 3 ml of local anesthesia through spinal cord, that is spinal anesthesia by sensorcan drug. Within when the incision was taken by the orthopedic surgeon, here the orthopedic surgeon was Lakshmanan Prakash. He was operating and another anesthetic was there. When the incision was taken, he noted that the blood flow that was oozing through that incision was not a proper one. It was slow. And therefore, he asked anesthetic to check whether uh, vital parameters are normal. When he checked that, it was noticed that the person was in a gasping condition. They tried to revive the person, but, but unfortunately, the patient died. So in this particular case, allegations was there. The case was filed in the consumer forum. Now, before that, I forgot to tell you that after death, the body was sent for postmortem examination, where during the postmortem examination, the cause of death was issued as lung shock as a sequelae of spinal anesthesia. So again, the second opinion was sought from the another forensic person. From the forensic department, they have issued the cause of death as acute respiratory failure, a sequelae to the spinal anesthesia administration. Now, allegations in this particular case was that the anesthetic, the one who has administered the anesthesia, he failed to check up during the pre-operative anesthesia checkup, which is a mandatory thing, that whether the patient would stand the 3 ml of administration of anesthesia drug, that is sensorcaine, which was administered through the spinal cord. And therefore, as the court said that there was a rash and negligent act on the part of anesthetic, and that was responsible for criminal liability as well as civil liability. However, the other two orthopedics were there. They were just liable for the civil responsibility. And so this case, what it narrates that, what you should remember, it is the importance of pre-anesthetic checkup, which is the most important part, which might save you from the litigations in future, if even if it arises. So second case, that is the Aruna Ben D. Kothari versus Navdeep Clinic. Again, this was a case which was decided by State Consumer Forum, where a person, the Aruna Ben Kothari, she is a deceased wife, and her husband, he sustained some injuries, and he was operated for that injuries, but there was some deformity. Again, the second operation was planned for this deformity. Before carrying out the operation, the pre-anesthetic checkup was carried out by physician. Anesthetic, he had also carried out that examination, but he referred the case to the physician and the cardiologist. During the examination, he noticed some changes in the ST wave, as well as the blood pressure was somewhat on the higher side, that is 100 by more than 150 by 100. Now, it was not an emergency operation, it was a plan operation. And while giving anesthesia, immediately after giving anesthesia, the patient, within some hours, within some time, the patient died on the operation theater. Now, there was allegations by the relatives that the amount of drug which was used by anesthetic was more than maximum. And second allegation was a proper monitoring was not done during the procedure. So that was the allegations. They have given a reference to some books of anesthesia also. The most important observation that you need to note here, it is the observation of the state commission. What they have observed, the complications and the death in the operation theater, where patients attendants have no access whatsoever, and therefore whatever the thing are there, it is the only the surgeon, anesthetic, and his team they are well aware about, and therefore the onus lies on the doctor to explain what events happened in the operation theater. So the state commission says that in such particular situation where the relatives they don't have any access, it is the responsibility of the surgeon and anesthetic to explain the death here. And therefore the maxim of res ipsa loquitur, that is the thick speaks for itself, they are applicable in such cases. Now, moreover, in this particular case, the cause of death was issued by the cardiologist who just arrived after the death. And second thing, the body was not sent for the postmortem examination. And therefore, in this case, it is difficult to diagnose what is the exact cause which is responsible for the death of that particular person. So as considering these circumstances, the anesthetic was held negligent for that act. The reason for not acting on a pre-anesthetic report, as I said, there are certain changes. The patient could have been treated for that, and then the operation could have been planned. But as he had not acted on the pre-anesthetic report, not ensuring that presence of defibrillator was there, even if some emergency arise, and he failed to prove that the patient did not have hypoxia. So the notes were not proper, which cannot say that the patient did not die because of hypoxia. So that is the reason that they have quoted the anesthetic as responsible for the death. So the liability was shared by all surgeon, anesthetic, and physician in the percentage as shown: surgeon 30%, anesthetic 60%, and physician 10%. So the compensation which was awarded as 4,15,000 rupees in this particular case. Now, why I'm saying this case laws here? It is not to show some fear, but you should take due precautions while giving anesthesia. You all are anesthetic are doing fantastic job by saving the life of so many persons. Without anesthetic, the surgeon would not operate, and therefore your role is very much important. And knowing that your is the highest and risky branch, still you are giving anesthesia very carefully. I must appreciate your efforts, but you should take deep precautions considering the medical legal issues or the allegations which might arise in these particular cases. So each and everyone is aware about the different types of anesthesia. There are different types. You are all aware: local anesthesia, regional anesthesia, epidural, epidural anesthesia, spinal, general, sedation, or many times the combination of these two are they are used. Each and everyone has its advantage and disadvantage. Out of that, most of the time, what we consider the most dangerous one, or there are certain risk element which is involved, it is the general anesthesia. So we should take each and every type of anesthesia with due care and precautions. The most important thing what is required as far as law is concerned, as far as safety of the person or patient is concerned, is the pre-anesthetic checkup. So pre-anesthetic checkup, it is a precondition for the safe anesthesia. As far as law is concerned, as far as medical legal issue is concerned, this is also the prerequisite, which is most important thing that should be documented properly. Had this documented properly, you can save yourself from the many litigations which arise in the future. So pre-anesthetic checkup is nothing but it is a routine medical checkup. It might be associated with certain lab investigations which are carried out before the operation. The reason why this is carried out, pre-anesthetic checkup, is to assess the physical status and any other medical problem or the diseases the patient might be suffering. So when you carry out the pre-anesthetic checkup, you come to know the exact condition of the person, whether the person is fit and how much the person is fit for the anesthesia. You are aware about ASI grading, where ASA grading, where you can say the patient is ASA 1 grade to 5 grade, it can be divided. So just by pre-anesthetic checkup, you can evaluate the physical and mental status of the person. Now this is the chance that you have during this physical status examination of physical status. You come to know whether the person is suffering from some disease. Many times the person might not be aware that he's suffering from some disease other than for which he's going to operate. So by this physical examination or by the lab investigation, many times you will diagnose that the person is suffering from some disease. You have chance to treat a person before the operation, and you can make a person as fit as possible for the surgery. So therefore you can minimize the risk which is involved in the operation, and that is most important thing that has to be carried out very meticulously, very sincerely. The most important thing that one should remember, each and everything that you carry out during the pre-anesthetic checkup, you carry out most of the thing, I know, but what we are feeling is the documentation part. We fail to document so many things. You might have asked the person, you might have carried out that examination, but you fail to note down in black and white on the paper, and that is the part which is missing in most of the cases where the litigations arise. So this examination, it consists of two parts: standard checkup and specific checkup. The standard checkup, which includes examination of the cardiac system, respiratory system, and neurological system. So you check the heart, whether there are certain things that you need to note, respiratory system and neurological checkup. Specific checkup, it is related with the particular parts where during anesthesia, that is more important, like examination of the neck, where you want to intubate a person, or during local anesthesia, that specific part you can check and note down. Now, during this process, when you carry out the pre-anesthetic checkup, you have a chance to interact with the patient, you have a chance to interact with the relatives of the patient. You just check the mental status of the person. Many times before carrying out the operation, the person has some fear in his mind regarding the operation. We are used to this routine process, but the relatives, they are not aware about this process, and they have some fear regarding any major operation or even for the minor operation. So during the interaction, you can minimize that fear, you can eliminate that fear by explaining the procedure which is required to be carried out for the operation and the anesthesia. Because most of the time the surgeon, they might be in a contact with the patient, but you have minimal access to the patient before the operation. So this chance you can utilize to build a mutual respect with the person and the relatives. So even if some in future, if there is some death, this interaction will help to connect with the person empathetically, and that's why this pre-anesthetic checkup is the most important part to avoid the future litigations. So what things that need to be checked and documented, that we will see. So pre-anesthetic checkup, that information that to be collected and documented. First and foremost important, you can ask about the previous surgical interventions. If the person had some previous surgical interventions, you can note down that surgical intervention. You can note down any consequences or sequelae that happened during the surgical intervention. Suppose some removal of organ is there, or some operative procedure is there in the abdomen, which might result into some adhesions, that you can check. Then second, whether the person was anesthetized before, whether what type of anesthesia he received in the past, whether he had some issues regarding that type of anesthesia, whether he had some allergies to that, whether he is comfortable with that anesthesia, and you can ask the person whether the same type of anesthesia that can be given this time. Then you can note down the allergic reactions. You can ask about specifically about the allergic reactions to any anesthetic drugs or any other drugs, or even to the any foods which might he has. So it might be a simple reactions, or it might be ranging from anaphylactic reactions. So you can ask whether he had some allergic reactions in the past. If he had some reactions, what type of reaction he has, ranging from mild to moderate to severe type of reactions, and note down in a capital letter if he had some reactions of that particular thing, so that when you are reading, your focus, or you can directly read that whether the person had some allergic reactions. Then you can ask whether the person had some prolonged bleeding tendencies previously during extraction of the tooth, or if he has some injuries in the past, whether the bleeding was prolonged, so that you come to know regarding the bleeding tendencies. Then you can ask about the smoking habits. If he had a smoking habits, then how much smoking habits, particularly per day, how much he smoke, for how many years he is smoking. So you can note down so that you can have a rough idea regarding the status of lungs, which is also useful in the post operative recovery. Then whether he is using some drugs or alcohol or medicaments for some treatment or as addiction. Then note down the history of diabetes, and since long he had diabetes. Then whether he is taking some medicine on the permanent basis, and during your anesthesia or operation, whether you need to ask or inform the person that you should need to stop that certain drugs, that is antiplatelet or some other drugs, which might be responsible for the more bleeding tendencies or difficulty in clotting. Then if you are operating on a female, then you need to know her last menstrual period, and you can rule out the possibility of pregnancy. Then after that, you can carry out detailed examination and inspection of the person from head to toe, especially head and neck that need to be checked. During examination of the neck, note down whether there is a short neck, whether there is some possibility of difficult intubation or some tumor or some lump is there in the neck, which might cause some difficulty in intubation. Then check up the jaws and its mobility. Again, you might face difficulty during the intubation because of the this jaw mobility. And also you can check specifically about the dental examination, whether there is some loose teeth. That is most important, because during the procedure, that loose teeth, chances that it might get loose and fall and pass into the respiratory tract accidentally. So all these examination can be carried out, especially if you are planning regional anesthesia. Then the site where you plan the puncture, that need to be checked specifically for any malformations or any infection. Then you can advise some lab investigations. Now there are certain what you can say, there is no specific criteria which lab investigations need to be advised, but depending on the patient's conditions and the illness, and for which the operation is planned, depending on that, you can advise different lab investigations and check the parameters before you carry out the operation. Especially in emergency, that is not important, but when it is a plan operation, that is compulsory. Then you can have a ECG and 2D echo if it is required, especially in case of aged persons. Then you can carry out X-ray screening for the status of the lungs. Now, based on your physical examination, lab investigations, ECG, and X-ray, if you think that persons require consultation by a specialist or physician or cardiologist or urologist, and depending on that, you can refer a person for consultations. Don't hesitate to consult the specialist here. If there are certain issues which you might miss depending upon your lab investigations or physical examination, that might go against the anesthetic if there are certain litigations. So specifically, you can consult the physician and take their opinion about the fitness of the person before anesthesia. So during all this process, when you are talking with the patient and the relatives, you get a bond with a person so that you can have some capacity of a person's mental conditions and psychological conditions. And during the same procedure, you can explain a person regarding the procedure of anesthesia, its complications, which might be there in case of anesthesia. So as I said, during the pre-anesthetic checkup, when you are explaining a person regarding what type of anesthesia you have planned, what type of complications which might arise because of the anesthesia, ranging from mild, moderate to severe risk that is involved in the anesthesia, that you need to explain. And you can take a consent in black and white from the person and witness as a relatives. If a patient is a minor one, no doubt below 18 years of age, the person is unsound, the person is not conscious, then you can take a consent from the relatives. Otherwise, if the patient is a major one, above 18 years of age, the person is conscious and well oriented, then you need to take a consent from the patient himself or herself. Many times it has been observed that a single consent is taken for operation and the anesthesia, which is absolutely wrong. You need to take a separate consent for anesthesia, you need to take a separate consent for the operation. Now, who is supposed to take the consent for the anesthesia? Ideally speaking, the onus of obtaining the consent, it lies with the person who is going to administer the anesthesia. As I said, when you are carrying out pre-anesthetic checkup, ideally the anesthetic who is going to administer the anesthesia, he should explain that pre-anesthetic checkup, he should explain the procedure, and he should obtain the consent there itself. Most important thing, whatever is documented, that you need to put it down on the paper as a written informed consent. Written means it is to be in the black and white, informed means each and everything procedure you need to explain, risk and complication which is involved in the anesthesia that you need to explain, and that is called as informed consent. If there is some queries by the relatives or by the patient, then you need to address properly and mention in the consent report. So that is the consent form. The consent form has to be signed by the patient if the patient is adult one, if minor by the relatives, and some witnesses should be there. We have seen many times the consent form, it is just mention the name of the person and the signature, while they have not mentioned the type of anesthesia, what risk they are involved in the anesthesia, which is a grave mistake on the part of doctors and the surgeons. I will show you one example here. So you can just observe over here. This is a consent form. This is a printed form which is there. Everything is mentioned. या हॉस्पिटलमध्ये संपूर्ण वास्तव्यात तपासण्या, बायोप्सी, एव्हरीथिंग इज कॅरीड आउट. इवन भूल देणे, बदरीकरण इत्यादीची जबाबदारीची संमती देत आहे. But it has not mentioned what type of anesthesia, who is going to operate, then name of the anesthetic, nothing is mentioned. They have just obtained a signature from the patient and the relatives without any witnesses also. So that should not be the form which should be attached with the papers which are to be sent to the police and the courts. All these forms they are produced in the court of law, and which indicate that you are least bothered about the care of the patient if such type of form they are submitted in the court of law. Now, before we start risk and complications during the procedure of anesthesia, the type of anesthesia that is to be administered, how it is administered, what different doses that are administered. Then during the operative procedure, you need to monitor a patient continuously, and each and everything that you are checking, like pulse, oxygen saturation, blood pressure, consciousness of the person, that each should be monitored and documented properly. This documentation ideally should be not more than 5 minutes. If emergency situation is there, first you need to settle the person, and then you can write down your notes. But that documentation has to be carried out properly. The monitoring has to be continuous. You should not leave as an anesthetic. You are not supposed to leave the person till the person recovered from the complete anesthetic effect. So that is mandatory as far as medical legal issues are concerned. During the operation, there are different risks and complications that might be there associated with anesthesia. So what we are talking here, it is the common complications. Please remember, as I said, it might be more in case of general anesthesia, but even in local anesthesia, even in epidural anesthesia, even in local regional anesthesia, some element of risk which is there, which it is difficult to predict. Basically, all these risks need to be explained before to the person, and if it arises, you need to be ready to tackle that complications. So remember the different complications which are there, which might be associated with anesthesia, especially the common complications which might be there, like hypoxemia, possibility of aspiration of the foreign materials in the respiratory tract, atelectasis, then pneumonia, then pulmonary edema, many times because of what you can say, giving if anesthetic is over prompt and giving more IV fluids, then there is a possibility of pulmonary edema, then pneumothorax, then air embolism, oxygen intoxication, and neurological sequelae. All these are the common complications you need to tackle. You might be aware all these things. This is not the thing that I should explain. You are very well aware about all these complications, and you are very well aware about how to tackle all these complications also. The most common complications that we are concerned with, it is the death on operation theater. We'll not be talking about the causative factors. it might be physiological, it might be pharmacological, physical or malfunctions. We're not going to detail about the complications, but we are more concerned about the, if there is a death on the operation theater, how to tackle, that is the serious form of complications in any operation, especially if you are given a fitness as ASA 1 or 2. In rest of the thing, the patient might be having some risk, but especially in ASA 1 and 2, if a healthy person, if the patient is healthy before the operation and death happened on the operation table or during anesthesia or during the operation suddenly, it is difficult to explain to the relatives which are outside, because they don't have any access to the operation theater, and there is usually allegations in such situation, in such scenarios, and therefore you need to be ready to tackle these issues thoroughly. So if you explain to the person or the relatives that there is a sudden death of the person during anesthesia, it will cause lot of distress to the relatives. No doubt there is nothing to say, because the person was healthy before the operation, before the anesthesia, and therefore it is not only distress to the relatives, but it is also distress to the complete team, those who are involved in the operation, like surgeon, anesthetic assistant or nursing staff which are there, because it is a combined responsibility of all, the surgeon and the anesthetics. And therefore here, to explain that sudden death of a person to the relatives, it is a serious issue that need to be tackled very seriously. And here the role of well developed communication skill is important. And therefore, as I said, during pre-anesthetic checkup, if you maintain a good rapport with the patient and the relatives, it might be somewhat easy if some untoward complications happen during the surgery. And therefore always insist that you should make a good communication with a patient before operation. That will be easy to communicate if some bad news is there during the operation. So here the role of well developed communication skill is there. I know it is difficult to say by sitting in the Zoom meeting, right? But it is difficult when you are tackling such situations. What is required is empathetic approach, which must be patient centered approach here, that need to be communicated properly in a situation where you should always say that you tried your all efforts to save the life of the person. So that need to be explained properly to person, but unfortunately the end result was not in our hand. Once you have broken that bad news, then you need to assess the situation, how the family members they are reacting to that situation, that you need to assess how much the degree of distress is there, that need to check. And if some issues are there, that need to be tackled properly, because as you are aware, there are certain news in the news channel, newspaper, that the relatives they have created a ruckus in the hospital. They have mishandled the doctors, nursing staff in the hospital. They have damaged the property of the hospital. That is a first reaction many times, which is difficult to digest to the relatives. And therefore, once you broke that bad news, you need to assess the degree of distress which is there. And depending on that, you need to take due precautions about how to tackle that situations. Now, in these situations, you need to remember the medical and medical legal issues which is there. The medical issue is how you have tackled the person, how you tried to save and revive the person. Each and everything need to be documented properly. That is the most important thing. Now, whether will you issue cause of death, even if you are aware about the cause of death, that is a second issue. We'll discuss later on. Is it possible to issue cause of death if you are aware about the death, cause of death, when in operation theater? My response will be, you are not supposed to issue cause of death in this particular case, as you expect there might be grievances by the relatives. It is always better that you inform it to the police station, nearest police station. MLC should be registered, and that the body should be sent for the postmortem examination. So that is the medical legal issue. Each and everyone should remember, if there is a sudden death of a person, patient during the operation theater or immediately after the operation, you are not supposed to issue the medical cause of death, medical certification of cause of death. Rather, each and every case has to be reported to the nearest police station, so that from your side, you are trying to justify that whoever is responsible for that, that need to be tackled by the law, and not by the not by the anesthetic and the surgeon. So the different causes of death which are related with the anesthesia, there are two types. So this is regarding the what we judge during the postmortem examination. As you are aware, if there are certain allegations about the criminal negligence in a death on operation table, then that case is referred to the committee. And I, being a part of member of that committee, we have gone through many papers which 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 we came across, and how these committees, or during the postmortem, how we judge the death on operation, of a patient on the operation theater. So there are two types of death that are there. First, the death which occurs during the administration of anesthesia, but which are not due to anesthesia. So that is one possibility. Second possibility is that death which are the direct result of the administration of anesthetic drugs. So that is the grave part for the anesthetics. So if it is categorized in the first part, there is no issue as such for the anesthetic. The only thing that need to be documented, based on that we are able to diagnose whether it is not related, the death is not related with the anesthesia. So we'll just go through one by one. So death which occurs during the administration of anesthesia, but which are not due to anesthesia. So first is, death might be due to injury or the disease which have necessitated the operation and the administration of anesthesia, especially the operation for which it has been planned. It might be serious in nature, which might itself responsible for death, and just the anesthesia might have precipitated the death. The second is death due to a disease other than for which the operation was undertaken, but which was not diagnosed, which was diagnosed before the operation. Like you might be carrying out some operations on a person, but the patient might be suffering from some valvular heart disease, right? So here itself, that valvular heart disease is responsible, it might be responsible for death. And even if the death happens, it might be a natural one, which is responsible by the valvular heart disease, and not the operation or the anesthetics. So it might have been precipitated by the anesthesia, but it is not the direct result of the anesthesia. Or it might happen that the death occurs due to a disease other than for which the operation was undertaken, but which was not diagnosed before the operation. That is the most serious issue. So during the pre-anesthetic checkup, you might have carried out certain investigations or examination, but in spite of that, it is difficult to diagnose that underlying disease, like coronary artery disease. It might not be, you might not observe that disease, but it might be responsible for death. So whether that heart problem is responsible for death, where you can rule out the role of anesthetic in the death on operation theater. And last, it is the surgical death or mishaps during the operations which might happens, like cutting of the artery, major artery, or ligation of that artery, which is responsible. So this is how first is categorized. Then second, death which are the direct result of administration of anesthetic drugs. So here, each and every anesthesia which has been administered, it might alter some respiratory system or cardiovascular system. So respiratory system and cardiovascular system, they are involved, and that might be responsible directly as a cause of death. So we'll just see some causes related with the respiratory system. First and foremost, the death due to respiratory failure, which is the one of the most common cause of death, which is responsible for death. So hypoxemia, because of the respiratory failure, and initially it might not be visible, it might not be that much serious, but ultimately resulting into anoxia and cyanosis. If there is no proper monitoring, then you might result into the death in such cases because of hypoxic damage. Then airway obstruction. During the anesthesia, you are aware there is a loss of protective reflexes, which might result into obstruction of respiratory tract by the soft tissues of the mouth and the pharynx, which might be responsible for the hypoxia. Then irritation of the larynx, again it might provoke the laryngeal spasm, again resulting into hypoxia. Or secretions of or the foreign bodies which might passively pass into the respiratory tract like dentures or omiters. Many times it might happen that there is an inadvertent placement of the endotracheal tube which might go unnoticed till the death happens, and later on it might be noticed that the endotracheal tube was not properly pressed, or the bronchial spasm might be there, especially those who are suffering from some respiratory problems. Then pneumothorax, the rupture of the lung might happen due to application of excessive pressure to the airways. Then positive pressure ventilation, which might result into a simple pneumothorax into tension pneumothorax, or even the use of nitrous oxide responsible for the pneumothorax. Or there might be possibility of aspiration of gastric contents, especially in case of emergency operation where the stomach is full, so resulting into aspiration of that gastric contents into the respiratory tracts. Then respiratory depression is there. As you are aware, all the respiratory anesthetic drugs, they are centrally acting respiratory depressant, or it might affect the some muscles which are responsible for the respiration, thereby resulting into respiratory depression. Or there might be some equipment failures which is responsible for respiratory system, that is failure of oxygen supply, or there might be empty oxygen cylinder, or there might be leak from the machine. That unexpected thing might happen during the anesthesia, which is also responsible for the death.